Welcome to the Fit Strong Women Over 50 podcast, episode number 183. Hi, I'm Chris. Thank you for joining us today.
And I'm Jill. Chris and I are your hosts for this podcast and the founders of the Becoming Ellie community.
We decided to name our community Becoming Ellie because Ellie was the Norse goddess of aging who beat Thor in a wrestling match. Jill and I thought, hey, we want to be like Ellie, fit and strong as we age.
Yes, you can find out more about the Becoming Ellie community and this podcast at our website, becomingellie.com. Ellie is spelled E-L-L-I. Sign up for our newsletter while you're there.
Today, we talk with Dr. Marcia Harris about hormones, perimenopause, and menopause. Let's go to the podcast.
We are thrilled to welcome Dr. Marcia Harris to the show. Dr. Harris is a pioneer in hormone optimization and women's health with over 40 years of clinical experience. She earned her medical degree from Columbia University and completed her training at Weill Cornell Medical Center. Over the decades, she has helped thousands of women restore hormonal balance and reclaim their energy, vitality, and confidence.
Dr. Harris brings a deep understanding of both the science and the lived experience of midlife. Today, we're talking about what really happens during this transition, what most women aren't told, and how to feel empowered instead of overwhelmed.
Welcome to the show, Marcia. We're so happy to have you here today.
Thank you. I'm really happy to be here as well.
Well, before we dive into all the specifics, can you share with us what led you to focus on hormone optimization and women's health? Was there something specifically that drew you to this field?
Well, women's health. My mother died in childbirth when I was 7.5, 8 years old.
Oh my gosh.
And I said at that time that I wanted to be a surgeon. I didn't even know the difference or what to call it, but I wanted to be a surgeon so that other little boys and girls wouldn't lose their mommies. So it actually started way back then.
Wow.
But then in college, I kind of got sidetracked and I was a speech and drama major. Yeah, I wanted to be on Broadway,
Sure.
And then halfway through college, my father sent the money to pay the fee and sent me a letter saying, "You're wasting my money. I don't know why you're doing this. Do you see anybody looking like you on Broadway? You can't even sing."
Oh, my goodness.
A real...
And at that point, I wrote void on the check, sent it back to
Oh my gosh.
and said, yep, 16.5, 17 years old, sent it back to him and said, "You know what? You worked hard for your money. I don't want you to lose it. So here, thank you, but it's okay." I went out and got not one, not two, 3 jobs in addition to continuing to carry my full-time schedule and graduated on time with honors.
Wow.
But it goes all the way back to there. So by the time, but at that point, I did change my major. It was effective.
Yeah.
Oh, I love it. That's a great story.
Yeah, it really is.
So actually, and then through medical school, I never wavered. I went in saying, let me go back to my 8-year-old dream, which was to deliver babies and take care of women. So
That's wonderful.
Many women start noticing shifts in mood, energy, their cycles in their 40s, late 40s, but they don't always connect the dots. What do you wish more women knew at the start of this phase?
Well, I wish they actually knew it even much earlier than that, because it doesn't start by when women notice it sometimes. It starts as much as 10 years before that. Perimenopause starts routinely around 39, 40, 41, 42, but can start as early as 35.
Oh, wow.
Actually can start as early as 35. And we tend to, as I said, suffer in silence. We tend to suffer in silence. As a matter of fact, I will tell you, even though I was a practicing gynecologist, when I started getting symptomatic, my then husband is the one who pointed it out to me. I couldn't, I did not initially figure out that the symptoms I was having were actually related to my hormonal changes. He is the one who said, I wish your period would just come already. I mean, you know, and that's when I was, whoa, you're right. It is my hormones. That is what it is. I mean, that's what actually did it include me in. Now, I actually had a very, very, very rough perimenopause leading up to menopause and beyond. It was really, really bad. It actually was to the point. I mean, I was at the hospital, for example. The nurses loved me. Everybody loved me. And then I started going through this period, and the nurses would see me coming and run. I mean, they literally would duck into rooms so as not to deal with me because they never knew whether I was going to be sweet and savory as I normally was or I was going to be screaming. They actually, at one point, got it down to looking at my feet. If I walked in my 3 and 4 and 5 inch heels, dressed to the nines, they'd smile. Hi, doc, how you doing? Because they knew I was in a good mood. But if I was in flat shoes, sneakers, or sandals, they would, oh man, let's get out of here. Let's not get in her way today.
Yeah, it is really unusual when you're going through perimenopause because you can't put your finger on it, but you have all these changes going on, and it seems like perimenopause is especially overlooked. What do you think some of the most common myths or misunderstandings are around perimenopause?
Oh, well, first, the main thing that I now focus on in reference to perimenopause is the education piece because we, as practitioners, really don't know very much about perimenopause or menopause because we were not taught. I actually went out there and found everything I now know and do for me because we were not taught. Going back to, well, let's go even before that. In the 70s and 80s and up to the early 90s, we put everybody on hormones. We weren't taught. We gave everybody hormones. We put everybody on hormones. And then in the mid 90s, what is her name? I forget the name of the woman who was in charge of the CDC, but she decided that we had all this information and we were doing these things saying that we put everybody on hormones because it protected the heart and it protected the brain and it protected the bone and all these things that we thought but had never proven. And she is the one who decided we need to do a study to prove these things. And that's how the Women's Health Initiative study came into being. What happened there, though, as I'm sure you all know, is that that's really what then sidelined hormone and menopause information going forward because they had 166,000 women. The study was completely flawed. Flawed in that, number one, there was nobody who had symptoms on the study. So the 45 and 50 and 55-year-old women were few and far between because if you, in filling out that form, said that you were having hot flashes or you were having insomnia or you were having anxiety and depression, they did not accept you for the study. So the average age of the women in the study was 65 to 66 years old.
Oh, my.
That's 15 years after menopause. The average age of menopause is 50 years old, 51. That was literally 15 years after menopause. So the damage had already been done. Does that make sense?
Right.
If we're doing this to prove that it helps with your heart and to prove that it's going to keep you from getting dementia, and we have the average age being 65, and you've gone through menopause 10 or 15 years ago, the
Yeah.
damage has already been done.
Yeah, and you're not proving anything.
You're not
There's
proving
nothing
anything.
there.
So the
Wow.
study was completely flawed from the beginning. And in addition to that, again, as you know, when it came out in 2002, they looked at the study and said, oh, this appears as if there's an increase in breast cancer. This appears as if there's an increase in dementia. And we need to take a look at this. They never did the usual unveiling of studies. I mean, where the committee sat down, went over the data, put it together, presented it, and then went from there. A pharmacist, not even a doctor, a pharmacist looked at it and said, oh my goodness, this is amazing. Breast cancer has gone up. This is not good. Told that to somebody else, and the next day it was headline, New York Times and Wall Street Journal. My phone rang 200 times that day.
Oh my gosh.
200 times, because everybody was shaking in their boots. We saw the headline, is that true? Am I going to get cancer? Now, if you look at it, and the study has been debunked within a year or two, everything was disproven or proven to be not statistically significant. But whereas it was headlines, it was now, a year or two later, 2 columns on page 50. So even the practitioners still, 70% of practitioners still say, oh, shouldn't take hormones because it's bad for you. You shouldn't take hormones. You're going to get cancer. You shouldn't take hormones. You're going to increase your risk of Alzheimer's. Practitioners are still doing that to women.
And that study came out, what, 2002?
2002. They broke that in 2002, and it's been debunked.
So that was more than 20 years ago, and it's still out
And
there.
the other bad thing is that they stopped teaching about menopause. They literally took it out of the curriculum at that point. So now we're getting back into it, but we're kind of late. I mean, we've missed an entire generation almost.
Well, hopefully it doesn't continue, right? That's one of the reasons why we're talking about it right now. So,
That is why we're talking about it. And I am just so thrilled and so happy that finally it's coming back into the spotlight, because women have been treated like second-class citizens all our lives. I mean, we are not part of any of the studies. They treat us like little men or small men, you know. All the research is done on men, and then they say, oh, okay, and extrapolate it to the women. But we're not little men.
No.
We're not little men. We're totally and completely different. So it's time that we actually they get our own information from us.
So is there any difference between, as far as misconceptions or how people think of it, between the perimenopause and menopause? So is there anything about menopause that you think women should know about that's somehow different?
Between perimenopause and menopause, well, what I would say is there are as many as 350 or 400 functions in the body that can be affected by perimenopause and menopause.
Oh,
And
my.
I'm not exaggerating,
I didn't
because
think there were that many functions of the body to begin with, let alone be
every
affected.
single cell in the body has hormone receptors. So when the when the hormones start declining, every single cell is affected in some way or other. You know what I mean? So basically, as the estrogen declines, as the testosterone declines, yes, women have testosterone. As the progesterone declines, even the adrenal hormones, everything else, the cortisol, the androstenedione, all the hormones, as they start, you know, going down, literally everything gets affected. And that's one of the problems. If you think about it, I'm sure you know a man who has had a heart attack or a stroke at 40 or 45 or 50. We as women don't start having heart attacks and strokes and that type of thing until we're 60 and 65, because it takes sometimes as much as 10 years or more for the hormones to be completely gone and to affect our tissue to the point where we start getting those problems. Women, the average age of life for women now is 86 years old.
That's
The average age
average?
for a man is 79.
Oh, wow.
A
And
difference. Yeah.
that difference has actually increased. Used to be lower and closer. So our hormones truly, truly, truly are protective.
Yeah.
Not only that, they figured out that if you've taken hormones, not only does it not cause breast cancer, it actually appears to be protective against things like breast cancer. And those have now been proven.
Well, do you think that the different myths are a mixture of cultural misunderstanding or medical or both, individually? What do you think
Yeah,
causes all these misunderstandings?
lack of information.
Okay.
As I said, not just on the part of women, but on the part of providers. What actually started me back in the arena, because was semi-retired, and what brought me back out here is exactly that. Because last year I had a 44-year-old woman come in. She had been increasingly symptomatic for a couple of years. She had seen 5 gynecologists, not 1, not 2, not 3, not 4, 5 over that space of time.
So you're not talking a general practitioner, but her actual gynecologist.
Gynecologists. Not only that, it took her 6 months to get an appointment with the head of the menopause clinic at one of the premier, I won't say which one of the premier medical institutions here in New York City. It took her 6 months to get an appointment, and that woman dismissed her.
Oh, my.
44 years old, the head of the menopause clinic said to her, you're 44. It probably could be, but it probably isn't. Here's a prescription for Prozac. Here's a prescription for gabapentin.
Didn't they check her hormones? I mean, didn't they do blood tests and find out?
She did nothing. She dismissed her. And that's when I said, no, I'm coming back out there because this is ridiculous. Somebody has to get on the bandwagon and get this corrected.
Talking about hormones, it brings up a lot of strong feelings. People are confused, they're afraid.
Completely.
Yeah, so let's just talk about that a little bit before we actually talk
Hormones
about.
themselves.
Yeah.
Yeah, the
Okay.
feelings associated with it too.
Hormones themselves, as I said, because of the fact that it's tied into every body function, they truly are really, really, really important, not to our existence, as well as to our longevity, as well as to our quality of life. They are completely tied in to all of the above. Now, we actually, as women, we can live without them But again, back to what I said before, the average age of death for your great, great, great grandmother and mine was 50. So by the time a woman was ready to go through menopause, she was also ready to die.
Well, they'd have such huge families, and there were so many things that would happen.
No, the infection would take them out. Childbirth would take them out. I mean, there were just no women. The women, average age of death was 50. Average age of menopause is 51. You know, so the dynamics have certainly changed. Women are now living 25 and 30 and 35 and 40% of their lives after they've gone through menopause. And the difference in women who do hormones is so great because you don't want to be 70 and 75 already pushing a stroller, already not being able to walk, or your motility is decreased, and your heart, you've got the heart trouble and all of the above. Whereas if we replace the hormones, you actually preserve your quality of life.
So when we talk about hormone therapy, what hormones specifically are we referring to? Are there a
Okay,
few?
that's a very good question. And I'm glad you asked it because that is also a problem. Back when we used to give everybody hormones, what we were giving people at that time, like candy, was horse's urine. They didn't even try to hide it. Premarin, pregnant mare's urine. Premarin. Okay? They
Yeah.
literally didn't even try to hide it. Now, what we're using is all plant based, and the diasgenin that is extracted from the Mexican wild yam and the edamame and the soy and the potatoes and wherever they're getting it is the exact molecule that the human body makes.
Is that what they mean by bioidentical?
That is what we mean by bioidentical. That is correct. And because of that, it's actually, to a certain extent, a different animal. It truly is. So not only is it's much safer because the body actually recognizes it because it's the same thing.
Can I go back for a minute that you mentioned that there's a whole generation of us who basically skipped out on hormone replacement. So if you're in your 60s and you never had hormone replacement, are you doomed? Or like, is there what can you do for yourself?
Well, let me put it this way. Lifestyle, there are other factors that come into play. One of the biggest ones being lifestyle. But having said that, nothing nothing comes close to actually replacing the hormones.
But you're not going
But
to give a 65-year-old woman hormones, are you? Would you?
yes, I am.
Oh, okay.
Yes, I am. The difference being, though, I would evaluate her differently before I do.
Okay.
I have to make sure that she does not have plaque on her coronary arteries for her to flip something. I literally will evaluate her to see if there is damage before I put her on anything. And it also, I will still treat her, but what I treat her with and how I treat her and how I watch her will be different than somebody who comes in at 40 or 44 with perimenopausal symptoms where I can get them then and make sure the damage doesn't occur.
Okay.
Does that make sense?
Yes.
Now, the North American Menopause Society guidelines actually says as little as possible for as short a time as possible. And then they upgraded that to say within 10 years of having gone through menopause. So if you went through menopause at 50, they said, okay, up to 60, you can give whatever and not worry about it. But again, it's not that simple, because as soon as they start declining, everything starts getting affected. So you really do have to make sure that there isn't a brewing problem before you do that. So I actually put a 72-year-old on hormones recently,
Wow.
but her calcium score was 0. She had no plaque. Her cholesterol was 149. You know, she had no hypertension. Her heart was not enlarged. I did a full workup on her. She exercised every single day, sometimes strength, sometimes aerobics. I mean, she did something every single day. She was a swimmer, and she was in amazing health. Guess what? She'll be fine.
So, when you're deciding whether someone might need hormone support, are you mostly looking at the symptoms or lab results? Or how do you decide which ones and how much?
The symptoms actually usually burn out. Some people, okay, 70% of people have symptoms for a while, 5, 6, 7, 8, 10 years. I have 10 to 15% of people who never get rid of their symptoms. And then I have 10 to 15% of people who have no symptoms at all,
Lucky people.
who come in and it's like, oh, no, 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 no hot flashes. No, no, sex is not painful. I mean, literally have no symptoms at all. But then you have that big gray middle where, and there are 34, I think, primary symptoms of perimenopause and menopause. 34. There are another 15 to 20 secondary symptoms. And then there are so many other things that can be related. We don't even give the tertiary ones a number. But when somebody comes in, for example, I had the most horrific symptoms. As I said, I found all of this for me because I was non functional. My hot flashes, I had 20 to 25 a day. And I literally would rip off the coat and rip off the jacket and look around and say, can I take off this blouse? Because I hope you've seen a bra and boobs before, because I can't take this. You know, I was horrible. The symptoms were really, really, really bad. And I told you the nurses would run because my irritability and I mean, I was insufferable. I would scream in a minute.
How often? So you just told us about the woman who went to see 5 different doctors. How often do you see women who are dismissed by their physicians or misdiagnosed or whatever?
80% of the time.
Oh my.
Yes. I would say now 25 to 30% of the practitioners out there are coming up to speed. 70% or more are still in the dark. It really is that bad. And again, you can't even, and I tell women this all the time, don't blame your doctor. They have not been taught. Do not blame your doctor. They have not been taught, because I wasn't taught any of this. I had to go and find it, as I said, for me.
It just seems like they should teach that. And have they done any other big studies since that big study back in the early 2000s?
There are a couple, there's the SWAN study. There are a couple of studies going right now. And there are other retrospective studies. They have actually gone back and looked at stuff, but there has been no other large prospective study since the WHI, since the Women's Health Initiative study.
Another thing I hear all the time, especially from women in midlife, is I'm just exhausted. So, can we talk a little bit about fatigue and why there's so much fatigue?
Yes. Again, it's hormonal. Now, some of that is adrenal. not related to the sex hormones. Some of it is, but some of it is adrenal. And unlike the sex hormones, the adrenals start burning out like how the men burn out their testosterone. So it's not related to the period, but it's incremental. It's like a little bit at a time, a little bit it's like 1 or 2% a year. So you can actually get away with it sometimes. And a lot of times it's also missed but it's usually missed because we don't look for it. You understand what I'm saying?
Yeah.
Because of that, adrenal fatigue, I mean, the burnout. And then in addition to that, the stress that we live under and in this day and age, and the toxins and the exposure and all of the other factors that come into play, we do have that is a major, major problem as well.
So, if you're dealing with fatigue, are there any things, simple things that we can do to start getting energy back?
Yes, lifestyle, diet, nutrition, exercise, how much water we drink, how much rest we get, all of those lifestyle parameters come into play in terms of, what we do. Now, there are a lot of supplements out there, which actually can also refire the adrenals, like ashwagandha and rhodiola. And there are these preparations, these supplements, plants, which they make a big difference. And basically what I do is I do a full workup, as I said, on everybody who comes in. It doesn't matter if they're 40 or 70. I do a full workup. And sometimes you'd be surprised at what type of outliers I pick up. Like I had somebody recently who had mold, had no idea she had it. But as a part of the workup, I do Lyme, I do mold, I do EBV, because they're outliers and they're not going to give you an answer, or it's not going to be that a lot of the times. But if you don't test for it, you're not going to find it. So the first time somebody comes in, I literally do everything: heavy metals, vitamins, inflammation. That's the other thing. The exposure right now, everybody's walking around inflamed. And if we were to get rid of the inflammation out there, that along with the vitamin D deficiency, if we were to get rid of vitamin D deficiency and inflammation, up to 50% of what we treat would disappear. Just getting people not inflamed and bringing their vitamin D up, because vitamin D is the basis of our immune system. You live in Ohio, I live in New York. For the people who are in Florida, for example, 40 to 50, 60 minutes of sun a day, and they've converted enough, tocopherol to vitamin D, they're fine. But you and I don't get enough sun, no matter what we do. Not only that, even the guys with the jackhammers out there for 6 or 8 hours, because of the way the sun hits and the ozone layer in this area, etc., you still don't get enough. So there are some things that have to be supplemented, like vitamin D, and you have to get rid of the inflammation.
And you get rid of inflammation through lifestyle or?
Lifestyle again, decrease your exposure and supplements. Lifestyle and supplements. For example, things like turmeric and again, ashwagandha, things like berberine. And these are all plant-based, but these are not things that you're going to get enough from your diet. So you kind of have to supplement.
Is there a certain place where you recommend people get their supplements?
Yeah, that's a problem too, because as you know, supplements are not really monitored. I can get some grass off my lawn, pulverize it, put it in a capsule, and sell it to you, and it would not be illegal, you know. But there are agencies like Consumer Foundation, NSF, Consumer Labs, and what's the third one? There are three agencies out there that try to monitor supplements. So you just have to make sure when you're buying stuff like that, that it's not something you've never heard of.
You said NSF, Consumer Labs.
Because, and they actually, I know recently, right after COVID, the government went in and just took stuff off the shelf at the vitamin shop and the GNC and stuff like that. And 70% of the supplements on those shelves actually came back to not have in them what they said they had in them. 70%.
Wow.
Yeah, that's the problem with supplements. It really is. So when it comes to inflammation, I guess drinking a lot of water, getting a lot of sleep.
Lifestyle. That is correct. And decreasing your exposure.
You were talking about adrenal fatigue. Is that something you treat, and is there some sort of hormonal thing you take for that, or how do you treat adrenal fatigue?
Depends on the cause. You can have a real problem with the adrenals, but most of the time it really is just the decline, the incremental decline, in which case you don't need to replace cortisol. You don't need, you know, medication. What you really need to do is fix the lifestyle. And you do that with supplements. Now, can I just say here, one of the big things that is often overlooked and missed is the fact that as women, we have testosterone as well. Not just testosterone. As a matter of fact, we have 10 times more testosterone than we have estrogen.
Really?
Estrogen, even though it's the uniquely female hormone, it is not our largest amount of hormone. We have more testosterone than we have estrogen. Now, we have 10 times less than men.
Okay, yeah. Now that makes sense.
We have 10 times less than men, but the testosterone in us does the same things it does for the men. The energy is testosterone related. Libido is testosterone related. Muscle toning, muscle building, bone building. Now, estrogen maintains our bones. Testosterone, however, rebuilds our bones. I now have the orthopods as well as the cardiologists sending me patients. Matter of fact, sidebar story, I had one woman who came in about 2.5, 3 years ago, having been sent by the orthopedist because she had osteopenia and osteoporosis, and she could not tolerate the pharmaceuticals. She couldn't tolerate them. And they said, go see Harris and put her on hormones, including, of course, testosterone. And I told her, because the studies on testosterone have actually shown that it rebuilds bone up to 8% per year. Up to 8% per year. And gave her all the information, gave her the statistics, put her on the hormones. And she came back, 6 months later and was like, can I repeat it? And I'm like, no, it's too early. You got to give it a couple of years, And she came back 6 months later and can I repeat it? And I said, no, it's too early. And she insisted when she came back the second time, which was a year later. She says, well, you said up to 8%. I said, yeah, but it's not linear. It's a parabola. It takes a while. It's very gradual. Then it takes off. So she's like, well, I don't care. I want to know what it is. I said, but, if we do it and it's only 1 or 2%, I haven't lied. It's coming. It's coming. And she insisted. I'm like, the insurance is not going to pay for it. I'll pay for it.
She wanted to do the
And
test to see how she fared?
she did. We did. And guess what?
What?
In a year, she had increased her bone density 5.5%.
Oh, I bet she was thrilled.
She was thrilled.
Yeah, I bet she
Okay.
was. That's
I have
great.
actually reversed osteopenia and osteoporosis with bioidentical hormones. Again, mostly the testosterone. Estrogen just maintains it. But testosterone actually can rebuild normal trabecular bone, right? Can actually rebuild normal trabecular bone.
That's fascinating. And I want to know, how do we find doctors who are you? I mean, how do we find someone who's going to actually do this testing and say, let me get you some hormones and we can rebuild your bone? And
Work through all of the different symptoms and figure it out. Yeah. Where?
That is a major problem. That is a major problem because, as I said, most physicians they don't have the information. You cannot hold it against them. So what I tell people to do is to look until you find a practitioner. There's a bunch of questions that I give out and say, these are the questions you ask. You go until you find someone who will actually work with you. Go on and change. It doesn't matter if it takes going to 5 different people. Keep going until you find somebody who definitely will work with you. It's difficult. It's difficult. But it's getting better. I will say it's getting better. And all of this uptick, with Halle Berry and Oprah and Nicole Kidman and Reese Witherspoon and all these guys getting in on it. As a matter of fact, I think there's something before Congress right now where they're trying to see if they can increase the amount of research that's actually done on women. Because as I said, we've been treated like second-class citizens. They don't care that we suffer.
you work in New York?
I work I'm licensed in New York, New Jersey, and Connecticut.
Okay.
But in terms of the way the system is set up now, I can actually do virtual consults from anybody anywhere.
Well,
And
okay.
I have people who fly in from actually patients from Dubai and Istanbul and Cape Town, South Africa. And I have people who fly also from New Orleans. And I have lots of people, and most of these are couples who drive down from Vermont and Maine and Massachusetts. I have this people that was there just last week who drove down from Vermont, came in, both of them saw me. By the way, I see men too, because they don't have menopause, they have andropause, but it's equivalent, you
Yeah,
know.
you never hear about that.
Oh, that's even worse,
Mm.
yes. But at least they have the research, which we are at a disadvantage because we don't have it. There are 29 products out there for this problem in men. There are 2 in women. How's that?
Wow.
9 for men. There are only 2 in women. So the research they're up to date on the research in men, but not in women. Because if you can imagine, if a man were to walk around ripping off his clothes and screaming at everybody and, doing the things that we do and we go through, they would figure out and find a way to fix it.
No doubt.
They would.
They wouldn't just pat you on the head and say, "Here, take some,"
Yeah, you know what? You just have to tough it out. It might stop in the next year or 2. It might go
or
for
it's all in
10.
your head. Yeah.
But yeah. It's in your head. And you know what I say when they tell me it's in my head? I tell them, you're right, it's in my head. Because this is controlled by the hypothalamus and the pituitary, which is in my head.
Good point.
So I know you've worked with so many women at this stage, and I would like to bring some hope into the mix because whoever's listening, they might just be shaking their head, worrying that there's no hope. Is there some things that you can tell us that are very encouraging?
There is tremendous hope because of the fact that if you do replace the hormones, if you do get treated, we can indeed stave off all the problems. We actually can. So there is a lot of hope out there. And now that it's finally coming to the forefront and being addressed, and we're not being asked to suffer in silence anymore, and we're kind of getting rid of the stigma that is attached, and people are talking about it. That's the beginning. There's a lot of hope.
Can you maybe tell us a story about someone who turned things around during their midlife and what made the biggest difference for her?
Absolutely. I had a woman come in, and she's now been my patient for I'm going to say 8 or 9 years. It's less than 10, but it's at least 8 or 9. And she was referred by one of my patients. She came in and she looked at me intensely and said, "Listen, I really hope you can help me because I'm going to kill a kid." She was the principal at one of the
Oh,
elite
yeah.
Upper East Side Manhattan schools. And she's like, "You got to help me. I'm going to kill a kid." And I worked with her. And when she came back, like literally after the second month, she walked in and my MA brought her in, handed me the chart and said, "Here are her labs, this is," gave me everything. And she was behind her. She stopped at the door, just inside the room, and she said, "Look, I have just one thing to say to you." And of course, Katie stopped because she didn't know if she was going to pull out a gun or she was going to pull out a hammer and beat me or whatever. Katie stopped and waited. Her hand was already on the door going out, and she turned around and she went, "Thank you, thank you, thank you, thank you, thank you. I feel like a person again." It is so amazing because when I say the difference is amazing, with treatment, the difference is amazing because it makes the difference that you actually feel like yourself again, feel like a person. I've had husbands call and thank me for giving them their wives back. I had one guy one day who made them interrupt me. He said, "No, I'm so sorry to do this, but you have to interrupt her." And they did. And he said, "Look, I am so sorry, but I just want you to know, I had already packed my things. I was leaving. I was moving out. I love her to death, but I couldn't take it anymore. I'm Thank you for giving me my wife."
Midlife always gets framed or often gets framed as a time of decline, but it can also be deeply empowering. And how do you help women take ownership of their health and see this stage as a new beginning?
And that is very, very important because a lot of times, if you do nothing, if they don't get treated, the difference is amazing. And people stop taking care of themselves, and the mental changes and all of that, all of the above makes such a difference most of the time. And as I keep saying, lifestyle, everything comes back to both lifestyle and treating. Now, there are people who will say, well, if you fix the lifestyle, and you get rid of the symptoms, you don't need to treat it. The problem with that is you're not getting rid of the decline. You really have to treat it to get rid of the decline. I mean, people look at me. I love telling people I've been out of medical school for 50 years because they look at me and do a double take like, oh my goodness, are you kidding? You look like 60. And I'm like, you
Well,
know
that's
what?
just what I was thinking. You look like 60, maybe even 55.
I look younger now than I did when I started this. I've been on hormone, bioidentical hormone treatments for 29 years
Oh my goodness.
because that's when I started. And I take the glasses off when I say that. you know, 29 years. I look younger now than I did 20 years ago because of the hormones, because it really does maintain, as opposed to falling off a cliff and crashing and burning, it really does maintain everything. Just as it maintains your vessels and protects your heart and protects your brain. We now know that it doesn't, unlike what the Women's Health Initiative said, that it made you get more dementia. It actually protects you against dementia. You know, it really, really, really makes a difference. So lifestyle is important, but you really should find someone to get treated
Yeah.
Right.
I
Somebody
because
thought
that knows to do the
you
labs and everything. Yeah.
fix the cause, which is replace the hormones, you literally get a second life. You know, your second act, I call it.
thank you so much, Marcia. This has been such a helpful and hopeful conversation.
Yes. Yes. Before we go, if our listeners want to learn more about your work or connect with you online, where can they go?
My practice is called the Wellness Restoration Center.
The Wellness Restoration Center.
The Wellness Restoration Center. I'm on Madison Avenue in Manhattan, New York.
Oh, wow.
And just put in my name or put in the Wellness Restoration Center and it comes right up. I have a couple of handouts. I have a menopause ebook, a free menopause ebook, and I have what I call the ultimate menopause survival toolkit,
Okay.
which I'm happy to send to anybody who just go online, put the name and the email or whatever, and just say send ebook or send toolkit.
Okay. All
Got it.
right.
We will do that.
That's great.
We'll make sure to put those links to your website and all of that in our show notes. Good. Good.
Thank you.
Thanks again. Thank you so much for joining us today.
Thank you so much for having me. And hope it was helpful. And any questions, again, women literally don't have to suffer. We do not have to suffer. I know we expect to, but we shouldn't, because the stigma should be done away with. We do not have to suffer.
Well, thank you so much. This has been very helpful. We'll talk again soon. Bye-bye.
Bye. I feel like we've talked a lot lately about perimenopause and menopause, but there's always more to learn.
Yes, a couple things that she said were not surprising, I guess, but new information for me. I guess I didn't realize that testosterone, we have 10 times more testosterone than estrogen, and all I ever hear about is estrogen. So that was kind of interesting. I knew women had testosterone, but I didn't realize it was that kind of levels. So
And I did not know that it was testosterone that builds muscle or builds bone. I know
right.
It makes
Right.
sense to me that testosterone would build muscle because
Yeah.
men are always supplementing or taking testosterone to bulk up if they can.
Yeah. Yeah. Well, it's just that was pretty interesting to me because I wasn't expecting that fact, and I guess you could probably tell because I think I went "wow" or something like that. I don't know.
Yeah. I was also interested. I was surprised. I guess if we're saying what we're surprised by, I was surprised by her saying that she puts people who have been out of menopause for a good while onto hormones.
Yeah. usually I hear about people using hormone replacement therapy or starting it when they're in perimenopause and starting to have a lot of symptoms.
Right.
But, it's all very interesting, and I don't know, I'm very eagerly awaiting to hear about I think she said it was the SWAN test, is that what it was? There was a new study that's coming out, not a test. SWAN studies, I think those are the new ones coming out, but, the Women's Health Initiative study, that just sticks in my head a lot more, but
Well, yeah, that didn't do us a whole lot of good, I gather.
well, it's just really nice as we look into the future and people are living to be, well into their hundreds, to have a quality of life past 51 years of age. You know what I mean? Like, I'm glad they're studying this stuff finally. It's great to feel great as you get older. And there's a lot of information out there, but not enough.
As Marcia said, they always have treated women as little men. Well, we're not little men.
Right.
I used to always watch my mother. They would put her on some sort of medication and she would have reactions to it. And I was like, well, my mother was a very petite, small woman. And you give her a normal dose of blood pressure medicine, it's not
And it's too
surprising that
much.
she's
Yeah.
passing out or being dizzy or whatever,
Yeah.
because they gave her something that they tested on a 6'2", 200-pound man.
Yeah. Well, I think they're getting smarter and
Yes.
working things in. I hope so anyway. We
Yes.
really
I just remembered that and being like, "Oh, this is not good." So it's good
Right.
that they're at least thinking about that now.
Right. Right. Exactly. So the other thing I was kind of surprised about, I didn't really realize that Dr. Marcia Harris practiced on Madison Avenue in downtown Manhattan.
I know, wow.
It's like, we're out here in Ohio in I don't want to say cow country, but I do have cows that live across the street from me. you know.
Yeah, but they are unusual in our
Yeah,
neighborhood,
yeah,
but
it's an unusual situation, but she's really downtown. you know.
yeah. It is interesting about finding a doctor who is willing to do that kind of testing and
Right.
to really do the whole thing. That is an unusual. So I think I'm gonna look for the questions. She said she had questions that you could ask
Yeah.
to find a doctor. I'm gonna look and see if that's on her website.
Yeah, yeah, and we'll put links to that kind of thing on the show notes. It may be where you fill in your email to get the information. I think that's more what it is than actually having the questions right there. But she mentioned something about an ultimate survival toolkit and a free menopause ebook. So I'm going to look for those as well.
So if you're listening, let Chris and me know if you have any thoughts on today's episode. We'd love to hear what your experience has been or what you thought about our conversation.
Yes, absolutely. We're always happy to hear from you. You can leave us a message at becomingellie.com. And you can also find us on social media as Becoming Ellie on Facebook, Instagram, Pinterest, YouTube, and LinkedIn.
Please consider joining our private Becoming Ellie Facebook group.
It was great talking to you today, Jill. I'm looking forward to our next episode of the Fit Strong Women Over 50 podcast.
I am too. See you next time. Bye-bye.
Bye.